Well, good afternoon, ladies and gentlemen, and welcome to the Holocaust Center, but actually welcome to the sixth presentation of what is taking place under our NEH, National Endowment for the Humanities program. Happily this morning, let me introduce someone who most of you are familiar with, but let me introduce anyway for those of you here who may not know her, and that is Lorraine Cupelli. Lorraine Cupelli, MS, RN, is a full-time assistant professor of nursing at Queensborough Community College, and her focus has been on experiential learning to foster deep, integrated, intercultural learning and to cultivate 21st century competencies for her nursing students from real-world experiences to improve population health-based outcomes. Ms. Cupelli has presented locally and nationally on this work. Ms. Cupelli has assisted transitioning associate degree nursing students from multicultural backgrounds to dual degree partnerships with the Hunter School of Nursing to meet the National Institute of Medicine recommendations of 80% of nurses being baccalaureate prepared by the year 2020. She maintains clinical competence by her certifications in emergency and critical care nursing and as a clinician in a healthcare facility. Currently, she is involved in a nurse workforce diversity grant from the Department of Health and Human Services, Human Resources and Service Administration to recruit minority high school students in undeserved neighborhoods to pursue a college pathway in nursing and to address self-health topics and health disparities in their community. In addition, Lorraine is no stranger to the Holocaust Center. She pioneered a program which has become one of my favorite here as director of the Holocaust Center, and that is to bring the students who are in the field of nursing to meet our Holocaust survivors and interact with them. And that program has been such a success that every year my survivors who are now in the 80s and 90s come to me and said, we're going to get those nursing students back again this year. So we're very, very excited about that. And Lorraine, thank you for coming here.
Thank you so much. Thank you so much for coming, and I'm really, really delighted to be here. And I'm going to be focusing on something extremely important in healthcare, and that's about cultural sensitivity. Not only is it important in healthcare, it's important all over. It's important in our world. It's important in our societies. When you know, things happen in the media that actually pulls away at culture and distracts from culture. Anyway, I'd like to start with a brief video and then go on from there. So I started out with this because I wanted to really emphasize the importance of cultural sensitivity, and that language barrier is one of many, many cultural barriers. Is one of many cultural barriers. Biases and stereotyping get in the way of health care providers caring for patients. The lack of culturally sensitive care, not understanding what those cultural viewpoints is not really understood by the health care providers and trying to achieve the best care as well. And also there's a lack of trust sometimes in healthcare providers. So it's so crucially important that when we provide quality care, that we really incorporate the culture, and culture being very broadly defined, not only ethnicity or race, but religion or language or historical experiences that they've gone through. It covers over a broad range of topics that every healthcare provider is committed to identifying to give you the best care. In fact, the latest 2007 report indicated there's a great need to address these cultural needs in the hospitals, and President Obama has attributed $354 million to decrease health disparities due to cultural barriers. So it's a very, very real problem, and you need that every time you walk into a healthcare facility. This particular person had to go to a particular facility to get the service. Every healthcare facility that you go into, you should be able to be provided with culturally sensitive care, whether it's a language, whether it's limited proficiency, whether there's a lack of understanding with the written material. You should be able to get the care that's understandable and respectful. Oh, I have this thing now. Okay, so the purpose of my presentation today is really to understand that our world, our contemporary world, is of increasing diversity, and to really understand that there are multiple cultural perspectives, and that us as healthcare providers, or future healthcare providers, or as patients, it's our job to understand your culture. It's not your job to understand the nurse or the provider. It's our job to understand you so we can give you the best possible care there is. And that's regardless of English proficiency, race, ethnicity, religion, historical experiences, and so on. And why do we need to bridge this gap? Because we live in a very multilingual, multiracial, multicultural society. The United States, our demographics are 30% minority right now. It's going up to 50%. So, and especially here on this campus or in New York City, it's a very, very diverse population. And my experiences as a nurse, I've had multiple lived experiences with many different types of people from all walks of life, from many different cultures. I've taken care of Holocaust victims. I've taken care of people that have gone through the civil rights movement. I've gone through many, many different ethnicities and religions and all different ages. And each of them come with their own viewpoints and cultural perspectives. And it's so crucially important, because those are often invisible, but those are often the viewpoints that kind of help us make our decisions regarding our health, or the way we manage our illness, or particularly how we're going to die. So it's so important to uncover the invisibility, the invisible cultures that actually dictate a lot of our decisions. And I'm so thankful to Dr. Flug and the Holocaust Center, because this has really been a meeting point for us as nursing students. For the last 4 years, our nursing students have been able to meet Holocaust survivors and really understand how that impact might have impacted their health. Particularly, I remember talking to a Holocaust, and one of my students talking, just many times for diagnostic procedures, you're NPO. They don't give you anything by mouth. And you wouldn't think anything of it, really, right? You're not going to eat anything, particularly overnight, because you're preparing for a procedure. But that not having enough food particularly triggered something very unpleasant in in a Holocaust survivor's mind, even though it certainly didn't have to do with anything there. It had to do for a procedure, but it triggered a memory. Or waiting online for X-ray. You would never think as a healthcare provider that that was impactful, that might have caused some anxiety, but it actually does. And so everyone, not only the Holocaust survivors, but my students got to meet with a veteran, a transgender person this particular year with the help of Professor Ickes, and also a Holocaust survivor and somebody who has been incarcerated. These are the other people in our society that we can't ignore. We have to help them and help them try to achieve the quality of life by giving them quality health care. It's a social justice issue, actually. Okay, so I'm going to present, and then my students actually going to be telling you about their experiences with these different types of individuals, and explaining what they've learned from different individuals, veterans and transgenders. And you'll be surprised that there's so much that we need to do as healthcare providers to make it better for people, all people, not just one set of people. So this is kind of the takeaway. I want you to understand what cultural sensitivity is. I want you to understand what the steps are, because there's really particular steps that healthcare providers and nurses need to have in order to be able to give culturally sensitive care. I want you to also understand that there are a lot of societal factors that may enhance our stereotypes or biases that we might have, and we have to look at that as a nation to try to disconnect from some of those things that might have some historical roots. I also want you to understand that there are populations in this nation that actually suffer poor health, that actually die earlier, that actually are sicker because of our lack of understanding what their viewpoints are. So, and this is a huge initiative in our current healthcare, whether you like Obamacare or not. It's about providing health as a basic right. Healthcare is a basic right. So that's some of the takeaway messages. And so when we talk about cultural sensitivity, we talk about understanding that there are differences among cultures. And we need cultural sensitivity to provide respectful care. We place a value on diversity, and we look at each and every individual, whether they're from a cultural group or not, that they all come with their unique individual differences. And that's so important, because no matter what, we all have associations, we all have thoughts or generalizations in our head, and it's so important as a healthcare provider to really try to be aware of it and remove it. Okay? In fact, a neighbor told me a story recently, and I said, oh, just if that nurse was culturally sensitive. This is a patient, elderly patient, grew up during the Depression, didn't have rugs in her home because she was very, very poor. And it was a scatter rug, and of course, as nurses, what nurses do, they say, that's unsafe. Remove it, you're going to trip on that. And so the daughter said, okay, I'll roll it up and put it underneath the bed. And so what did the patient, the 84-year-old patient, do? Took the rug, unrolled it, and put it back in her bedroom. And what happened the next day? She broke her hip. Okay, that's a cultural sensitive. She associated the lack of rugs about being impoverished, and at 84 years old, she wasn't going to have that. So if we could have somehow uncovered that, and I know that symbolically it's not easy to understand the concept of a rug, but what I'm trying to prove or trying to understand or convey is that we are masked, you know, as humans, but we have so much inside that contributes to our decision making. And it's so important to be able to uncover that, not only within not only for a healthcare perspective, but just to get along in this world, to be able to negotiate employee relations, to be able to have, you know, be friends with your neighbors, to be able to live in a society that's more harmonious. We have to understand that we are different. There's a lot of similarities, but we are different. And that we have to come from a respectful place to appreciate those differences. So whatever I say here for healthcare providers or nurses, I think that we can take all of this in our own backyard and use some of it. So, okay. Okay, so why is it important? Why do we need to do that? Is because I said to you, demographically, our minorities are at 30%, they're increasing to 50%. There's a large amount of minorities that have health disparities. Okay, so that's the health of our nation. We're all affected by that. Why bridge cultural gaps? Because our health professions, even though there's 30% minorities, there's only 10% nurses. There's only 6% physicians that are minorities. There's only 5% dental. So there's a difference right there and then, and that's why I'm on that HRSA grant to recruit underrepresented minorities into these professions, so we can close the cultural gap. It's sometimes easier for someone to have a cultural match and be able to convey really important health information when you're from the same culture. But we don't have that here in our nation. That does not exist, okay? So either we have minorities that are in those positions, or we need to be attentive to what's invisible to us, okay? Why else because I mentioned health disparities. They're significant. I mean, African American men are dying much more of colon cancer than they should be. And you know what? Their screening is a lot less. The recommendation to get a colonoscopy at 50 or 45 or 50 is a lot less. Well, why is that? Right? Why are Hispanics women dying of cervical cancer when there's a pap smear that you can have? Why is the screening not being done? Okay, so there are real disparities, as evidenced in the video. The woman didn't want to be a burden. The medical part was not meeting their needs. She had to manipulate her son, felt like, and that's why she didn't go to doctors. Those things really happen, and they shouldn't happen. Every health facility is deemed by cultural and linguistic standards that is mandated from state and federal level. So that shouldn't happen. So, and also unequal health care. Hispanics, Asians, American Indian, and African American are more likely than whites to state that their healthcare providers sometimes or never listen carefully, does not explain things clearly, or respect what they have to say or spend enough time with them. So there's not only disparities in health conditions, there's disparities in treatment and possible decision making that might go on. So it's so important to close this gap for many, many. And so it's so important as an academic institution to teach cultural diversity, particularly very, very important for nurses, but we all need to be taught cultural tolerance, right? That's very, very important. So that's our goal, to recognize and value diversity. Culture does have an effect on health. And often it's invisible. And I mean that broadly. Culture should be defined broadly. It's just not, I hear, well, it's just race or ethnic related. No. It could be do with language. It has to do with socioeconomic. It has to do with limited English proficiency. It has to do with immigration status. It might be an occupation that's contributing to the culture. There's so much. So you have to think of culture on very broad terms, not on just racial and an ethnicity. Because that's who we are today. That's what makes us up. And there's multiple. If I was to stand in front of you today and tell you several of my cultural groups that contribute to the decision making that I have, right? I'm Croatian, I'm a firstborn American, I'm a Queens resident, I'm married, all of that culminating presents what our culture is today. And that's our job as healthcare providers, to really kind of understand that and walk into your life. You're not walking into my life, and to provide care in the prescription of your culture, right? So that's kind of my goal here. And so you have to think about some of the societal factors that contribute to some of our biases, because I said that biases and stereotyping is one of the things that actually contributes to our lack of cultural sensitivity. And this is a gay man that basically was beaten up. He was walking in Chelsea and was beaten up because he was gay. That's why he was beaten up. And so these negative stereotypes that go on in our society, how do they contribute to that patient? They shouldn't contribute to that patient-provider interaction, but they do. And my students will tell you the experiences that they've had, the transgender patients that are transgender have had with the healthcare it's discriminatory. Which, by the way, the number of attacks against gays in the New York City is 68 reported this year, and 1 was actually murdered in Greenwich Village for being gay. I have a collection, as I talk, these are a collection of just recent media events that have occurred in our society. There are about a lot of different cultural groups and health disparities. So I'm going to pass it, and you can just kind of pass it as I begin to speak. And this is basically happened after the Boston Marathon. Basically, he was beaten up. This actually in New York, this happened. He was actually Bangladeshi, but he was dubbed as an Arab, and he was beaten up because that was post the Boston Marathon. Well, what if this patient just walked into a health facility? Would they get the care that they need? Or maybe you walked into a health facility and you were actually going to be treated by someone who is Muslim. How would you feel about that? Right? How do these factors contribute to to our interactions? Okay, even educated people have stereotypes, right? Football player today, maybe a doctor tomorrow, maybe a nurse tomorrow, right? Beat up someone because they were Asian. So you have to think about these external factors on how they impact our quality care today. And of course, anti-Semitic is still, right? The Holocaust wasn't enough, right? It still continues, the historical roots, and how does that pervade into our system today, okay? So these exist, and they do have bearing. One of the #1 reasons why quality care is not achieved is the lack of cultural competence in healthcare, due to stereotypes or biases. So how do we begin to recognize individuals as unique? How do we begin to appreciate and respect different cultures? We have to start becoming aware of what we're about, aware of our viewpoints, aware of what cultural perspectives that we are. And as specifically healthcare providers, it's so important because sometimes we try to impose our own values on someone else without even knowing it, with sometimes the best intentions, right? I mean, say if a patient came in and said, I'm very, very concerned about my partner, taking care of the kids while I'm in the hospital, you might automatically assume, oh, let me call your husband, right? Well, we don't live in that type of society. We don't live in that society. We need to be completely sensitive to the fact that this partner might be another woman, right? We need to be sensitive to that. So a nurse must understand his or her own culture and also the culture of the nursing profession. We are bound by the code of ethics, and that's fantastic, but we are still a human being who has their own culture, and so that contributes to who we are, and it's so vitally important to look at that. They really need to examine their reactions honestly, and that your perceptions might be in conflict with your patients, and that you are there to help your patient within their own cultural framework. Assist in healing in what they think might be appropriate. If they want to wear a St. Francis of Assisi medal on them because they feel that that's going to help them get through this, we'll do that. I remember taking care of an Orthodox Jewish man who family is so, so important to them. And that was when restrictions, there was an intensive care unit, and there was only two visitors allowed. But it was the Sabbath. And he was really doing very, very poorly psychologically. And the family was always there, but they all had to come in, rotate in, rotate in, rotate in. And you know what, I asked the administrators if they could have just 30 minutes so they can sing for the Sabbath. And you know, it gave such a great smile to this patient. It maybe didn't make him particularly physically better, but psychologically it gave him maybe the motive to get better. So it's so important. So in essence, ignore my lipstick and listen to what I'm trying to tell you. Really effectively listen. That's an art. That's a skill, to effectively listen and to interpret. And I really try, for my nursing students, they meet people from different cultures to really listen, to understand what they're saying, what motivates them to maintain healthiness, what helps them maintain chronic illnesses or manage their illness, and how are they going to deal with the concept of dying and death. It's not going to be the professional medical way, it's going to be the way that's comfortable for them. Of course, course, anything that they may harm themselves, we would never allow that, but we have to work within. So with that, sometimes when we don't understand our patients and we don't listen, we almost make them invisible. There's been several groups in this country that we've tried to make invisible. And that's so important not to. So with that, I want to, Samantha, if you could, or Samantha, just hand out that, there's a quote that I'm going to have Trevane read. And basically, this is from Ralph Ellison, 1952. He wrote the novel Invisible Man. He's an African American and an American being in the 1950s. And he often felt invisible in the 1950s because of the civil rights movements. Well, I think sometimes we make other people invisible just because it's just more comfortable that way. It's what's comfortable for us, and it's really not appropriate. Okay, so I just want, it's on the other side. Yeah, it looks like this, okay? And this is a novel, but I just took a little bit of a quote because he was made to feel invisible, and I wonder how much we make other people feel invisible maybe because they're different. They're different. So Trevane, you're going to read this. You can come over here if you want. Just watch the wires.
Alright, so I'm an invisible man. No, I'm not a spook like those who haunted Edgar Allan Poe. I'm a man of substance, of flesh and bones, fiber and liquid. Yeah, and I might even possess a mind. I'm invisible because people refuse to see me. It is though I'm surrounded by mirrors. When they approach me, they only see my surroundings, themselves, or figments of their imagination. And let me confess, you ache with the need to exist in the real world, and you strike out, you curse and swear to make them recognize you. And at last, it is seldom success.
Thank you so much. So just as his plight was to become visible, well, it's many people's plight, the tenant farmer, or the migrant worker, or the illegal alien that wants to be made visible in this world and to be given equal and justified health care. And so we need to make groups more visible, and we need to be conscientious of that. And I think that we can relate this to the Holocaust survivors, and we also can relate this to many with a lot of disadvantaged groups here in America, that we make them invisible because it's comfortable. Well, it's not comfortable any longer. And so with that, on the back of your sheet, I have lyrics to a song. I'm going to play a little bit of the song. It's about 3 minutes, a little long, but I want you I'm playing this song because I think it represents a voice to some of these invisible groups and gives the concept that we need to have social justice for all, that health care is a basic right, and that just because someone is different doesn't mean that we can't accept them. Okay, so we're sometimes blinded by a lot. And so as I play this song, I want you to think about what are some of the vulnerable populations in our society, and how does it relate to cultural sensitivity, and what are some of the barriers that we have in this world to actually prevent them from getting the best quality care. So I thought this song, really promoted a strong social message. I think it's really important to understand that there are disadvantaged groups. They're not being given the same justice that all are. Did anyone think of any groups that they saw that particularly may not? I mean, I know there's a huge promotion for gay rights, but there's so many other people that need the same rights, the ones that are voiceless. And I thought that this gave a voice to those groups. And I think as healthcare providers, we have to advocate for what's the invisible groups. We have to provide the best care for them. And so, okay. So I'm just going to go through this a couple, because I know we started late and I want my students to come. But there are some really key words in this song that helps us, that they're lesser, they're devalued, that we are more superior. Well, who are we, and who are we, and how is that correct and appropriate that somebody is more superior or not? Okay, so we have to look at history and what social justice issues are, and everyone deserves basic health care. So we need to accept differences. Right? You don't have to have it in your own life, you have to accept it and tolerate it and be able to work with it, okay? And so you see that not only have we oppressed gays, but we've oppressed people that are gender or racial or skin color, and so that exists in our society. And how does that influence the interactions? And again, we need to be the voice for the voiceless. And so we have to recognize that there's a common ground, there's a common similarities with all of us. And that's what we need to focus on and be able to accept. So where does that bring us? It brings us to cultural sensitivity. And so you as nurses, as a group, needs to go through certain steps. You need to, first of all, be aware, and that's what I already mentioned. It's impossible to know everything about a culture, but you need to ask particular questions to actually gain the knowledge. You have to be motivated by desire to actually understand what different cultures are about. And in healthcare, some areas in which individual culture affects beliefs and values include someone's perception of health. What does it mean to be sick? What does it mean to have a quality of life? How does death become part of my discussion? And how do I interpret death? So that's what you need to do. And you need to listen with respect, recognize and understand a client's culture, and then partner with them what they feel is going to be the most important for their lives. And so this is I'm going to be introducing my students, but these are my students that interviewed 2 women that were transgender. And they'll be explaining. We had also my students interviewing a veteran, and how has being a veteran impacted his health and decisions that he made. And then women that have been incarcerated, right? And how the impact of their incarceration, because these are the other individuals in our society that are not invisible, they're visible, okay? And this is also our Holocaust survivor, to see how a traumatic event has impacted their decisions in terms of their health and death. So there is, and research demonstrates that there's a lack of cultural sensitivity, and that we need to bring it in our forefront to really give the best care. And then I'm not going to go through all of this, but there are disparities. There are sexual orientation disparities. There are, and they'll go through some of them, there are some racial and ethnic disparities. And where do they originate from? Is it due to the lack of trust? Is it due to stereotypes? Is it due, it's not only due to socioeconomic and lack of insurance. So these are quite, basically minorities die earlier, they're a lot more sicker, and they're given less diagnostic treatments or recommendations for procedures. So I'm just kind of going through this because I want my students to come up here. And there's all different types of disparities. It's not only race or ethnically. It can be due to traumatic experience. It could be age-related, it could be gender-related. Certainly there's education and income disparities as well. So they come from many, many different areas. And so I just want to, because I wanted just to spotlight some beliefs. Samantha, would you give out the second thing? And then I'm going to get off so my students can come up here. There are a bunch of questions that we asked the Holocaust survivors, and my students also asked of the veterans as well as the individuals that were transgender. In order to find out what someone's cultural perspectives are, you've got to ask them. You've got to ask the right questions. And so what I'm handing out here is a lot of the questions that we ask. And sometimes people are uncomfortable asking questions, but that's the only way you're going to really understand someone's culture. So I thought I would give it to the audience, particularly. This is basically for the Holocaust survivor, and I've compiled a bunch of answers that you may particularly want to know. We've asked some culturally sensitive questions to the Holocaust survivor, and you would be surprised by their answers. And it really goes to display that their impact that's on really does impact their viewpoints on health. That's what our focus is. Does anyone have a particular question that they want me to answer? This is over several years of my students interviewing Holocaust survivors. And I'll go over just a couple of them in a matter of time. Okay, how about number 9? In what ways has the Holocaust experience affected you today in your attitude, the way you cope with problems, and your religion? Well, one said, I don't believe in God anymore. I don't pray anymore, my husband doesn't either. Where another Holocaust survivor said, it made me stronger. I have a very positive attitude. I go to the temple, I celebrate holy days. There's no problems with my religion. So different Holocaust survivors went through the same type of experience, but has different viewpoints. Everything is replaceable except human life. I want to see the world in peace. Treat your fellow human being with respect. We are all God's children. It doesn't matter your ethnicity or race. The Holocaust made me stronger. It helped me cope with hardships later in my life. So 4 different Holocaust survivors and 4 different viewpoints. I'm sorry, you have a question, Samantha? Number 4, okay. Were you sick at any time during the Holocaust, and what did you do to get better? Well, one had a stomach virus, and she was given a piece of charcoal. My mother tried to keep me healthy because if the soldiers knew I was sick, they would kill me. And then another was, I had diarrhea and bronchitis at the camp. I couldn't do anything to avoid getting sick. Medical care was non-existent. I like particularly, what kind of helpful advice, no.
About
12? Okay. What are your...
I'm sorry, I'm 13.
Okay. This is what would be important for a nurse to know about you to provide you with the best care. And that's so important for every healthcare provider to ask you, what do I need to know about you to bridge that gap so I can help you? And one, waiting in line upsets them. Having experience lining up in concentration camps, they cannot tolerate waiting in line. Afraid of hospitals. You go to the hospital to die. So now when you're talking to someone, you're taking care of someone that's gone through an experience, and they're extremely anxious. You have to and it might be due to this event. They can think of someone as poisoning them. This was really the reality of German hospitals. They need choices. They never had choices in a camp. When one particular gentleman was given a choice about an aortic valve, either medication or surgery, he was able to choose because he was given a choice. He was never given a choice when he was in the camp. And so that in itself, that was given a choice, was something that was, and you would never think of that, right? You would never think of that. So just like I'm uncovering the impact of the Holocaust on these viewpoints, there is a whole myriad of other cultures that contribute to some of their decisions. And so that was the main point of my presentation. So I don't want to go any further because my students have worked very, very hard, and we do have a remaining 40 minutes left, and they're basically going to be telling about their impact of someone's culture on their health. and maybe one of the Holocaust, an individual who's transgender, one that is been incarcerated, or a veteran. And so this is just a template of our society, just a handful, but there's so many other different types of people. And so with that, I'm going to call them up, and then the next group is going to be talking about developing cultural sensitivity among health providers. I want to thank you so much. And so with that, I will call up the first group. Thank you.
Hi folks, my name is Jenna Genois, and my classmates and I, we are going to talk to you today about how culture, like background, can actually impact the healthcare. First, let's just describe what is culture. Culture, this is basically what we have been taught in our motherland, obviously. This is our belief, our values. But mostly people, when they think about culture, they think about race and ethnicity. But it's not only race and ethnicity, it's about everything. It's about socioeconomic, it's about your background, it's about your experience. And this is what makes us who we are. So as we can see, like the world is really different. There's different countries, there's different cultures, and even just shrink it up like to America. America is just such a melting pot. It's different, it's a really multicultural continent. But just here also, we have different, most likely people from different country, and I'm pretty sure you guys have different background, different culture. I'm just gonna go ahead and just ask a question, real quick. Anybody who will be willing to tell me where they're from, and basically tell me what do they think about, like, what is health for them? Just 1 or 2%. Oh, I'll just choose. Yes, tell me. Okay, that's nice. Anybody else? I'm just gonna go ahead and pick somebody. What about you? Would you mind telling me where you're from and what do you think of health?
I'm from Jamaica as well, and health for me means always thinking about being physically, mentally, emotionally is especially important to me.
This is exactly what I was gonna go through. They're from the same country, and apparently they have different meaning of health. She thinks in a more holistic way. She thinks in a more of absence of disease. Me personally, I'm from Haiti, and I think health is just the absence of disease. That's it. Well, it's different, probably because I have different experiences. Something probably happened to me. This is what makes me think the way I think. Something probably happened to her, and they think differently. A lot of things can affect the way you think of health. And let's go on the certain aspect that can affect it. Socioeconomically, a person who's actually really poor might not be having the ability, the possibility to go to the doctor, to actually go to the, to get information. So you're poor, you're just gonna stay home, you are going to just, this is going to affect your health in a bad way. It's going to lead to poor health. Because the health, just to go to the hospital is really expensive. You don't have the money to do it. How are you gonna be able to actually help yourself to cure yourself for any type of disease? Like malnutrition, for example. Person is having lack of protein, and just a little brief information, protein helps in the immune system. It helps you against the flu, for example, and it helps if you have a cut, protein is gonna help you healing, and if you have lack this protein, it's going to lead to poor health, and the person might end up in worsening the situation. But if you do have the possibility and you can actually afford to go to a hospital and get the information, it's going to help that person get a better health. It's going to help that person improve their health in a way. And also, culture-wise, I'm talking about religion, which is a really biggie in this one. If you think of religion, some people, for example, in my country, in Haiti, they are not really Christian, but they are mostly Voodooism. And not me though, I really am Christian. But they're mostly Voodooism, and like you can see in this picture, they think of something else when they sick. When they sick, they do not think this is they need the medical support. They actually think it's probably a bad spirit. Somebody's doing something to them, and they need the bokor, which is in a way their God, to actually cure them. But certain people, they don't believe in science. They believe that this is just God. God's gonna do his thing. He's going to help me cure myself. I'm just gonna pray, put money down, and it's gonna happen. Then again, this might lead to improve your health, since you have that peace of mind thinking of this higher power is gonna help you, which give you less stress. And we all know stress is a bad thing. It might get things worse. But sometimes you actually do need that assistant, you do need that doctor to help you. And in this way, it's gonna lead to poor health. And also, when we're talking about background and experience, we can see some people, they've been through things that actually can affect them and make them think of life a different way that they used to think about it. Let's go quick to somebody who's been through like sexual abuse, somebody who's been forced to take drugs or something. They will probably, they will not trust the doctor with the vaccine for the flu. Perhaps they will get scared of the syringe. It will remind them of what they've been through. And for example, as my professor was saying before, a Holocaust survivor probably will not really go to the doctor because she or he knows that while going there, he probably experienced it before, and he was waiting on the line for the X-ray, and this brings back memories when he was waiting on the line during the Holocaust. Or sometimes some people during the Holocaust, they were what they were being experienced on for other things. So they got a lot of disease because of they were just trying on medication on them, and the trust with the doctor wasn't there, and they're not going to trust any doctor right now. Then again, you might be through the Holocaust, and it doesn't affect you in a bad way. It actually makes you stronger. And I had the opportunity to interview this wonderful woman. She has told me that she was a Holocaust survivor, and she has told me that she doesn't forget the memories. It's still there. But during the Holocaust, her mother was taken away from her. And that day when her mother was taken away from her, she told herself that she will not be another victim of Hitler, and she will do everything to stay alive. And that's what kept her alive during the Holocaust. And she said this keeps going with her towards her life. And she is such a positive woman. She actually told me, don't give up on nursing, even though it's hard, you're gonna make it. Like, she was helping me in a way. But that's to show you that even though, like, it affects people in different ways. So that's how, when you're looking at the world, you see the person think of health a different way. The person act towards her health a different way is because of the culture. And don't forget, culture is not only ethnicity, it's not only race, it's the background, it's the experiences. And we're gonna go ahead on how culture can affect the health also on other people. They actually interview the veteran, for example, Trevine. I'm gonna introduce my classmate right now. Trevine.
Hello, good afternoon, everyone. How you doing today? My name is Trevine Waldron. I was born in Linden, Guyana, right, which is in the Caribbean, right? Now, as everybody can say, when everybody take a good look at me, I've worn Army attire, right? And I've done this to represent veterans, which is who I'm going to be speaking about today. Now, it's actually a privilege to me to be wearing this uniform or any uniform, because in the Caribbean, you don't wear Army clothes. It's actually, I don't want to call it a crime, but they will arrest you for wearing the Army, all right? Okay, so I had the pleasure of interviewing. Okay, yeah, I had the pleasure of interviewing a veteran by the name of Rick Carrier. Rick Carrier is his name, Rick Carey's name, right? So I'm gonna briefly talk about his life. I'm gonna present his life, and then I'm gonna go into some diseases and things that affect veterans that we as nurses students and we as a community have to deal with when they come back from the war, right? So like I said, I interviewed this wonderful man by the name of Rick Carrier. He spent almost 3 years of his life in the military, right? His military background is affected all aspects of his life. All aspects of his life. He joined the military in 1943, and now at the age of 88 years old, 60-something years later after the military, his military training is just still with him throughout his whole life, right? He took part in all 3 aspects of the military, the Marines, the Army, and the Navy as well, right? So the military has affected his cultural background as well in a psychological aspect. He mentioned to me that he had a heart problem, right, in which he had to get a stent placed into the valves of his heart, right? And one thing that he stood out to me, as I asked him how did he work through that, he said, he went to rehab, he had to go through it, but he said the thing that he quoted that you have to eat the pain. You have to eat the pain is what he said, which, in the military, they teach you to suppress your pain. You suppress your pain, so these guys, they end up having a high pain tolerance, a high pain tolerance. Another thing that's influenced his psychological aspect is the topic of death. When we spoke about death, he said, he asked him if he was afraid of death. He said he was exposed to so much death in like the wars, that event. Basically, he built up a tolerance. So he's seen it so much, it doesn't affect him in any kind of way, right? We also asked him, when I asked him, what does he do to upkeep his health? What does he do to maintain his health? The first thing he stated is that first you have to be responsible. You have to be responsible for everything going on in your body. You have to be responsible for everything going on in your body. And some of the things that he does to be responsible for his own self is that he drinks 2 liters of water for hydration, right? He also reads up on his own health. This is a man that's very capable, very knowledgeable. Which is looking at him, this is what I want to be as I get older, right? He drinks a lot of water. He reads up on his health. He mentioned the Indian herbal remedy that he says relieves pain in about a week, right? He also does breathing exercise. He mentioned took deep breath and breathe out. He says in order to promote bowel movement, right? Peristalsis, right? Which my professor mentioned earlier. Right, and the whole aspect of being responsible, knowing you have a job to being responsible for your own self. It is also stemming from his military background, in which he had to be responsible on the battlefield. Be responsible for his own self. And his military background has put him in countless dangerous positions in which he had to face, right? But overall, Rick Carey, he's had positive experience with nurses and with the healthcare field, right? But not everybody has the same result as coming back from war and as coming back from different battlefields. Some people suffer from post-traumatic stress disorder, right? Post-traumatic stress disorder, which actually leads to suicide rates, right? And post-traumatic stress disorder, it comes from a traumatic event that has occurred either in your life, but it's most prevalent with our veterans that we see. That's where we see majority of PTSD occurring. Right? Some examples of it is that reliving the traumatic event, which includes nightmares, avoidance of situations that remind you of the traumatic event, feeling numb or dissociated, feeling tense or keyed up, right? And some interesting stats on PTSD that I found is that out of everybody with PTSD, only 50% actually seek treatment. And out of those 50% that seek treatment, only half of that actually receive minimal help. So what we're actually doing, we need to actually improve more or make this a vocal point for our military veterans that are coming back home. Right, and also 20% of the Iraq and Afghanistan veterans have post-traumatic stress disorder or depression, like it is up there as well, and they lead to drug abuse, and the veterans lead to drug abuse. 39% are alcohol abusers, which is the next thing. Lead to drug abuse. right? And as far as suicides, which the PTSD leads to suicides, we see it increasing. When I actually did my research, I saw, as you see there, the numbers are increasing. From 2010, June 2010, it was 123 suicides that we had from our military background. In 2011, June, we had 130, right? And then in 2012, it says, in 2012, from the 1st of January to June 7th, there was a suicide every day by a veteran. And now in this article that recently came out about the Fort Hood shooter, which his name was Ivan Lopez. I'm going to talk about him just now recently. It says, this is the article came out from the federal government, Department of Veterans Affairs. It says that 22 veterans kill themselves every day, which is a startling number to me, because that's quite an increase from 2010. But as our wars are getting more violent, this is what is occurring. The traumatic events are becoming more prevalent, and they're being seen more every day, right? So the Fort Hood shooting, we even had that was basically what it was like 2 weeks ago. The Fort Hood shooting occurred, and this was the second time in 2009 that it occurred there first. And then just the other day, about 2 weeks ago, is when the Fort Hood shooting occurred again. Now this guy, Ivan Lopez, he served in Iraq 4 months. He served in Iraq for 4 months, and then he came back. He was diagnosed with PTSD, and he was actually receiving treatment for it. But he went and he bought a gun. It didn't say, the article didn't reveal why or what triggered him to get a gun. But I mean, just think about if there was somebody there or somebody that we could have keyed in on him. What more could we have done to actually help him? And he basically went on a killing spree on the army base. On the army base. Now everybody's trying to figure out and find out why, like what occurred with him now when it should have been done before, because he's a veteran, right? And okay. That was it. All right, and so that's it for me. Thank you guys very much. Now I'm going to introduce my classmate.
Good afternoon, everyone. Thank you for attending. Oh, I have the mic here. Okay, even better. Thank you for being here. Today I'll be discussing the issues in health regarding the formerly incarcerated. Now, as Juvain has spoke of the military personnel, I do have a little experience with that. I served 4 years in the U.S. Navy from '89 till '93. And although I have not confronted or been confronted with the acts of war and battle, I can say that us veterans can be somewhat hard-headed, and we think that we can pretty much cure ourselves by drinking healthy stuff and running 5 or 6 miles, which that is not the case. And this topic here, the formerly incarcerated women, I do also have experience in this, not that I've basically been in jail myself, but I did have a loved one, of course, who also went to jail for a quite long time. And the sad part about his stay was, which I'll say was my brother, it was a 10-year prison sentence, and when he came out at the age of 29, he came out pretty much with nothing to show for, pretty much. He started from scratch. Here in New York, of course, we get a license at the age of 20 and 21, so he went to the other age of, 20, so he didn't have his license. And when you come out, just to get your license, pretty much, you need, or just an identification, you need a lot of, what's the word again? Not prereq, but you need other identifiers. You need your birth certificate, you need a credit card. You didn't have all these things. So I was, well, he was fortunate enough that his older brother, of course, like my younger brother myself, had a credit card, which I pretty much put in his name, and therefore he accumulated enough points to get himself pretty much his license, which is needed just to go job seeking. And we realized, of course, that with the incarcerated people, pretty much, that when they return back to the civilian environment, they lack health insurance coverage and different types of health care that are adequately coordinated, and the quality of care, of course, that they do receive upon leaving prison pretty much is suboptimal. As we see over here, 55.1% of people in the U.S. pretty much have employment-based health insurance. So that means that most people who come out of prison have issues getting a job. Why? Because of this lovely box here that states, have you ever been convicted of a crime? So luckily, now there's been a movement in over 50 cities and counties that have joined this unfair employment barrier practices, where they have removed this box, or this check box, from the applications. And we see even Texas, a Republican state, pretty much is one of the participants. Surprising. And this pretty much will help the formerly incarcerated women, especially, to go out and get the job that's required and necessary for them, pretty much not only to get back to their life, but to I don't know, regain that sense of dignity and pride, because when you start working, you feel good about yourselves. And unfortunately for many women, it states that, of course, as you see here, this map here, pretty much the increase from 1990 to 2002, pretty much the steady increase of women pretty much being incarcerated. And we also see that this disparity pretty much is not only, it's compounded pretty much depending on your ethnicity and your race. It states that out of 91 women, of course, actually 91 white women, 1 in 91, excuse me, are incarcerated. 1 in 18 African-American women are incarcerated, and 1 in 45 Hispanic women are incarcerated. So we realize that the healthcare disparities pretty much can also be attributed to one's race. According to the CDC, there is compelling evidence that race and ethnicity pretty much correlate with the increasing healthcare disparities amongst U.S. populations, which must be addressed. And this trend, of course, as we see here, is slightly increasing. So out of the two women that I had the privilege of interviewing, I realized that they both had similarities, but at the same time, what separated the two was their education. One of the women pretty much had a 10th grade educational level, while the other one was pursuing her associate's degree and aspires, of course, of achieving a bachelor's. And by talking between the two, I realized that the one who had a higher education spoke more eloquently, she was well versed, and she had, which unfortunately was, you could say, was much more going for her. She had pretty much already, she envisions herself pretty much not only receiving her bachelor's within a few years, but also starting her own business. And meanwhile, the other woman, of course, with the 10th grade reading level, she unfortunately was a mother of 2. And even though she had lived pretty much, it was, I think, 10 years of her life in and out of prison, you saw that because she didn't have a high education level, you realize that pretty much she's hitting a dead wall. And getting beyond that, it's not that it's not foreseeable, but you see that she has a much more high mountain to climb. And that's the sad part that we all see pretty much of the prison system. Is there to rehabilitate people, and obviously they're not doing that much of a good job, because when you come out of prison, you come out with limited to no resources. If you're convicted, pretty much, if you have a drug-related charge or a sexual-related charge, you don't qualify for educational benefits. So it could be pretty much, I don't know, selling marijuana or cocaine out the streets, and that's a drug-related charge. You go to prison for it, and you come out, and guess what? No money for you to go to school. No money for you to go to school, and at the same time, you have to pretty much declare yourself as a felon, and that, of course, will result in your application pretty much being placed at the bottom of the pile. And therefore, no job, no money, no resource for an education, what's going on, what's happening, I have no idea. But since I know that I've experienced on my side of the family imprisonment, I realize that a helping hand, of course, is needed. And it doesn't take much. It pretty much takes a little time out of our busy schedules, which for some reason we think it's busy, but really is it that busy enough to help someone, whether it's family related, or even a friend, or even being involved. As a nurse, I'm pretty sure that we'll all be involved with people pretty much in some circumstances, and it's our job pretty much to help them. It's another stat over here that two-thirds of all incarcerated women on average have 2 dependent minor children. So here you have a parent who goes to jail, their children pretty much are sent to foster care, live with relatives, they come out, and guess what? Not only do you have your children pretty much under foster care or under the care of someone else, but now the struggle of you regaining or custody of those children. And so that pretty much adds to a really stressed out life, as it wasn't as stressed out as enough being in jail. Oops, before I pass this baton over to my classmate here, I just want to make one thing that's very important. People who go to jail, regardless of what their crime they're being charged, we're not here to judge, we're here to help. And that's what we are, basically. It's not only nurses, because I can't say that because we are only nurses that we should help. I think as human beings we should help. And knowing that this might be your family member, this might be, God forbid, your child. You know, I have a 14-year-old, I'm doing my best to pretty much keep on the right track, but if she happens to fall in the right track, in the wrong track, I hope that someone pretty much is at least caring enough to say, okay, how can we remedy your situation? How can we help you become the citizen that you want to become? Because I don't think that out of all the people who fall in, or go to jail pretty much, I don't think that that's what they grew up saying. I want to go to jail for 10 years and come out, of course, with limited resources, no education. So next time you see someone basically in need of help, just offer a caring hand. It doesn't take much. Thank you.
Hello everyone, my name is Michael Anton Davis, and I had the pleasure of interviewing 2 transgender women, Julissa and Brooke, and coming into the interview I had no prior interactions with any transgender women, and so I just wanted to keep an open mind and understand everything and take in everything that they tell me during the interview. And what I heard from them really opened my eyes to how they are treated by the healthcare industry and healthcare providers. Their culture and background definitely has a huge impact on how healthcare providers treat them. These are just examples of transgender women. And it's more negative than positive. They spoke of two main approaches by healthcare providers. One is of disrespect, where they're treated as a number instead of a human. Healthcare providers treat people like us, where no one can, there's no noticeable difference, and they treat us with respect, with compassion, with the way we're supposed to be treated. But they see, the healthcare providers see them, and they're treated immediately with disrespect, and just treated as numbers, like I said. The second approach is of nonchalance, and what I mean with that is that doctors expect the transgender women to teach them about their health instead of the other way around. Doctors should be the ones telling them what their health is, what should be healthy and what is unhealthy to them, and that's not the case with that approach. Their background definitely has had a big impact on them. Their family background is what I mean. They didn't have the same support system that we got, that most of us got. Teachers, their parents, their fellow students, their classmates, their friends, they basically shunned them from. They didn't get the proper social environment. Sorry, the questions will be. Sorry about that. They didn't get the proper social environment that regular kids should have gotten growing up. All right. About their health, the major thing is their mental health. Their baseline mental state has to be higher than the normal person who wakes up with a smile, like they said. When they wake up, they have to consider if they'll feel feminine that day, if they feel like wanting to interact with other people that day. It's definitely different than how we wake up, where we just go about our business. They have to decide if they want to, interact with the world that day. So some of them become homebodies because of that, and that leads to depression. The suicide rate is 9 times the national average, and that also ties with the mental health. Poor mental health can lead to self-esteem problems, can lead to drug problems, other major health problems. It could lead to unsafe practices where transgender women are more open to like I said, unsafe practices, which will make them more vulnerable to diseases. And just to add to that, they said that sometimes suicide might even be liberating to them, because throughout their lives they're denied of who they are as a core human, they're denied the core as a human being, who they are, what their gender is, how they want to feel. Some of them live as the opposite sex, and that's how some of them live. They hide behind that, and they might live full lives, but they hide behind that their entire lives. So what should the nurses' approaches be? 3 things: treat them with respect, compassion, kindness, understanding, just like us, average human beings. We should definitely establish a rapport. First thing when they come in, don't make it awkward. Establish a rapport. Establish that good relationship with them, and they'll trust the healthcare system more, and they'll keep coming back. And because that's a major issue for them, they come into a clinic, they get shunned, and they don't want to come back anymore. So I think that's it for me. With that, I'm gonna pass it on to Jenna.
Thank you, Michael. Well, now I'm just going to conclude it, but before I finish, I would like to reflect back whatever you just learned right now. Well, I'm just gonna choose one person. Samantha Doima. Thank you. Let's say no, yes. So I'm just gonna ask you a good question. You did say you're Jamaican, right? And you did say for you it's a more holistic way health is for you. I would just want you to go back and just tell me how would you react towards your health, and what in your life actually make you react that way. Thank you. The word right there she said is because of her background. And thank you, Franz Samantha. I just want you guys to go home and think about it. Think about why how would you react towards your health and why you would react that way, and try to understand that somebody might have a different opinion about health and they will act probably a different way towards their health, and just don't judge them. It's just because of what they've been through, because of their background. We're all different, but we're all human. Thank you very much.
Okay, I have to be brief. Good evening, ladies and gentlemen. My name is Nicole Mawat. This is Samantha Dunbar. This is my fellow student, Jonathan Santos. We're here to elaborate on, as we heard about different cultures and how it affects your health beliefs, we're here to emphasize on the need for cultural sensitivity in the healthcare system. We interviewed specific subcultures, as you heard a while ago, and the general consensus among this group was the negative treatment that they received when they went into the healthcare system. Now, in order for us to be sensitive to veterans, we have to understand that they might be depressed, they might have post-traumatic stress disorder, they might have substance abuse like alcohol and drug abuse because of the experiences that they have received. So in order for you to treat people from this particular group, you have to be cognizant of the fact that they're coming with different issues and different stressful, when they replay what they have experienced from in the battlefield, it might affect them mentally, so you have to understand that, and that will enable you to form a sensible plan of treatment and care for these individuals in the specific groups. And for the transgender women, it's not easy for them, as they said, as my fellow student Michael says, is that they are misunderstood generally, because the healthcare professionals don't know how to respond to them. They don't know what to refer to them, especially if you're a man transitioning to a woman, or a woman transitioning to a man. They don't know what to call you, so they treat you with disrespect, and they don't want to assist you. They don't want to care for you. So generally, people in these groups, they don't want to go to the healthcare. They don't want to seek healthcare. So some of them will, if they're experiencing illnesses, they would rather stay at home other than seek healthcare. With these groups also, if you're a transgender woman, you have to be sensitive to the fact that they may be taking estrogen in order to transition over to a woman. So this can cause high blood pressure and clotting, and they may have swelling due to the fact that they are taking estrogen. And they also may have low blood pressure and low blood sugar. They also may have depression because their family members and the people in their social groups have not accepted their need for a transition and don't understand why they are transitioning over to a different gender. So they may feel isolated, they may have depression, they may want to stay, they may have problems with obesity, because if you're depressed, you don't want to go out anywhere, you don't want to see anybody, you don't want to interact with anyone. So in order for us as healthcare individuals to better be able to care for these individuals, we have to ask them. Instead of us making judgments when they come to us as healthcare professionals, we need to ask them what they want to be referred to. What are their health concerns? What is affecting them? Instead of passing judgment. And for the lady, for the formerly incarcerated individual, she said, I had the pleasure of interviewing the two formerly incarcerated women, and what she said to me was that they didn't treat her with respect. They didn't give her a good reception when she went into the healthcare system, and she abused drugs at some point in her life, and she contracted an illness from that. And it's as if they said, oh, this lady again, what is she doing here again? I don't want to take care of her. And she could hear them physically speaking about her behind her back, while instead of giving care and promoting health, the healthcare professionals were backbiting and were speaking about her in a negative way. And she said all she asked for is for to be understood, and for the healthcare professionals to just ask and don't assume anything. And she also blamed the healthcare profession about the death of her parents. She recently lost her two parents, and she says that her mother died due to the lack of health care, proper health care. She had a pacemaker and it wasn't changed, so that contributed to her mother not being alive today. So it's really imperative for us as healthcare individuals to really assess how we feel and to put away all the biases that we have towards people of different groups, of different subcultures, and not see them as a barrier just because they are different, just because they act different, just because they look different, just because their practices are different. I'm not going to treat them with respect and with dignity that they deserve. And we need to be aware of our biases before we can provide health care. We need to ask ourselves, do we have the skill to conduct a cultural assessment? You know, when we meet different patients in these groups, we need to know if am I knowledgeable about worldviews and about different cultural and ethnic groups, and do I seek to go out and interact with people from different cultural groups in order to enable me to understand and have a better understanding about how I can approach and treat individuals from these specific groups. And we need to ask ourselves as individuals, do I really want to be culturally competent? Do I really desire to be that way? We have to ask ourselves these questions, and being culturally sensitive, we have adopted some models. There's the LEARN model, and there's the 4 C's of culture, which my fellow colleague will expound on. So I'm going to hand over to her. And just the gist of what I want to leave with you is that you have to be cognizant of your biases and your beliefs and your culture in order to be sensitive to other people's culture. Thank you.
Good afternoon, everyone. I'm Samantha. Today I'm going to be presenting a series of situations that has occurred. It includes both inappropriate and appropriate ways of nurse and patient interactions, basically. And we'll be elaborating on it afterwards. Okay? Walter? So, first I'm going to be interacting with a veteran, Mr. Waldron. Good afternoon, Mr. Waldron. How are you doing today? I'm Samantha, your nurse. Are you taking care of me? Yes, how are you?
I'm not doing so well. I have a lot of pain in my back. It's hurting.
Oh, yeah. Okay, so first what I'll do is go and check on the
Wait, hold on. I have something else to tell you. My stories, back when I was in Iraq, is there something the matter?
Yes, Mr. Waldron. I have 8 patients today.
Oh, okay.
I can't just stay around and listen to your stories. All right? So let me check on that complication, and I'll be right back. All right? Okay. All right. So, okay. Is there anyone who would like to volunteer and let me to tell me what the nurse did wrong here? Anyone? Definitely. Correct. Yes, that's exactly it. So as nurses, we have to be cultural. Yes.
Can I ask you about that? What do you do in that situation?
What do you do?
So you do have 8 patients. I mean, you probably do.
Yes.
How would you suggest that?
Okay. First, I would, of course, listen to him for a little bit. Yes, but I could also take him out to the nurses' station. There's a nursing manager there. I'm sure while doing her paperwork, she wouldn't mind listening, but of course you have to listen to the patient first, because if you don't listen, you're not going to know what to address with a patient. And as nurses, we don't only address the pain, or let's say the symptom, illness, disease. We don't only address that, we address the whole patient per se. All right? Okay. We have another sister. Alejandro? That is a man.
Definitely not.
Oh,
Why is he just like a woman?
What? He's a man. He's a man. Alejandro Fulgencio, the doctor is ready to see you.
Excuse me, my name
Yes.
is Alejandra.
Alejandro.
Alejandra, yes.
Okay. So you're a woman.
Yes, I am a woman, and you are being very rude.
I am?
Yes, you are.
Okay.
And I honestly, I expect an apology.
And that's not happening.
Really?
No.
Then,
The doctor's ready to see you. Would you
if I
like?
get an apology, then I'm leaving.
Okay. So, bye.
Goodbye.
Okay. All right. Okay. I'm sorry. I hate being rude to people. Again, we see it being demonstrated, and this is the actual situation. When I did my interview with the transgender women, this is something that they said actually happened, and should never be the case. Whether or not, it doesn't matter who you are. It's common courtesy to be polite. Common courtesy should never be happening. It doesn't matter who you are. Alejandro, could you come back, please?
As a he or she.
What do you feel comfortable at? Okay, in this case, the proper thing for the nurse to do is to ask the patient, how do you see yourself? What would you like me to address you by? What gender do you see yourself at? There, you have to ask. That's the main thing. You have to ask, and you have to listen. Because if you're asking a question and you're not listening to the answer, it doesn't make any point in asking. So, would you like me to address you today?
As Alejandra, I'm a woman.
Okay, thank you.
Just didn't have time to shave.
Okay, thank you. Okay, come around. And again, we have one more scenario.
Thank you. Samantha, do you remember Jean? Miss Jean?
Miss Jean? Is that the drug addict? I haven't seen her in a long time. Did she die?
Well, she's outside. She's your patient today, so good luck.
I can't with these people. Let's just keep doing stuff. Samantha, you remember me in yesterday? How are you doing? I haven't seen you in a long time. Listen, wow, things happen. They really do. They sure do. Excuse me a moment. Okay, no problem. Maybe not me, but someone will be right in. She was in prison. Are you kidding me? I don't associate myself with criminals. You will have to take care of her. I'm not doing it. I'm not doing it. So who's doing it? Oh, that's not my problem. That's not, no. Again, we see these are actual situations. I see your face and you look horrified. Yes, and I'm saying these are actual situations that people have experienced. And again, they should not be happening at all, never be happening in any circumstances. Everyone needs to be treated with respect. That is a common courtesy. Doesn't matter who you are, where you're from, your beliefs, your culture, language barriers. It doesn't even matter. It's just common courtesy for you to be nice to people, be polite, and just ask questions and listen to answers. In March, I'll just give you a tidbit of information here. In March 2001, the Department of Health and Human Services established national standards of culturally and linguistically appropriate services. These standards are supposed to be used in all healthcare systems, hospital, clinics, nursing homes, even home visiting nurses, I believe, have to abide by these standards. When a few of these standards are to provide a diverse workforce. We need diversity because we are diverse people. And as Professor stated, I'm Jamaican, Nicole's Jamaican, if we were to interact as nurse and patient, it would be a better fit than if she had an Italian nurse come in to see her. Maybe she wouldn't be so open to discuss her healthcare issues with that nurse. Also, to provide language assistance is a big thing. If you don't understand what the person is saying, I mean, it's only common sense to get someone who does. You don't understand. Get someone on the phone to come up and say, oh, let me translate for you. It's okay. We are not being, I don't know. It's just, okay. So I'm very emotionally disturbed by this subject. Also, it is to educate and train the workforce in the class standards. If they don't know what they're supposed to do, then they're not going to do it. They don't know, they're not going to do it. So that's the key thing here is to educate and train the workforce in these standards. Okay? And also I have a handout. It's the 4 C's of culture. It's to be aware, to have the skill to be culturally sensitive. Ask yourself, do I have the skill to go into this Jamaican patient and be culturally sensitive to her because of her beliefs, her background, her experiences? Even a Holocaust survivor, coming dressed in white might affect a Holocaust survivor. Might. To have the knowledge. Pre-handed that, oh, my patient today is a Holocaust survivor. Do I go research? Do a little background research. to develop some kind of knowledge, awareness of how you're going to interact with this patient. And your encounters, be mindful of your body language, how you speak to the patient, you know, just the whole aura of everything. And have the desire to be culturally sensitive. We must have the desire to want to help people no matter what race or innate background they have, no matter the culture, the belief. It's the same thing over and over again, no matter what. As nurses, as healthcare professionals, as whatever occupation you are in, as a human being, no matter what, we have to be culturally sensitive to everyone around us. All right? Thank you. And Jonathan, my classmate, is coming over to close.
Hello everybody, I'm Jonathan Santos. I'm one of the student nurses here, and basically my job here is to ask the crowd questions based on the material that has been given today, and maybe take some feedback after that and bring the presentation to a conclusion. I just need 1 second to set up. Okay, what is cultural sensitivity and why is it so important for healthcare professionals to utilize? What is the ultimate goal? And it's on the screen. Okay. A, to ensure quality, unbiased healthcare is provided. B, to make clients feel comfortable when receiving treatment, even though they may have cultural differences. Or C, to ensure clients do not experience fear when seeking medical consultation or treatment. Or D, all of the above. Okay, good. That's great. Yeah. Basically, you know, you don't ever want to make anybody feel unwelcome or unwanted for any reason. You know, no matter what you feel, you know, you need to take that and put it aside, because everybody has certain biases. If you say you don't, then I don't know. But you know, in any medical profession, your only job is to take care of people. Everything else is, you know, out the window. So, okay, number 2. What are some of the steps you can take to provide proper and effective care with regard to cultural sensitivity? And it's a 2-part question. Basically, prior to entering a pre-existing client's room or upon somebody's initial admission to a facility. So what are some of the steps you can take to basically meet cultural needs? Anyone? Okay.
Yeah, I mean, you can educate possibly in terms of either reading, or somebody mentioned going actually into the culture in some way to have more exposure, get better understanding, like you've done here in terms of interviewing people from the populations.
All right, anybody else want to add to that? Samantha? Oh.
Well, you can ask. That's what you.
That's it.
Yeah. You mentioned that number of times. Oh, you just ask somebody. You have. We all have these nice green questions and answers.
Yeah. Basically, one of the answers to both of the 2 parts of the question, basically, asking questions and finding out information. You can check a patient's health history. All hospitals and facilities have computers with their background information, so you can do that. And upon initial upon initial admission to the facility, you can, interview them basically. So yeah, that's it. Okay, number 3. When are healthcare professionals legally obligated to administer treatment, even if it is against the client's cultural beliefs? A, when a client is not competent. B, when a client doesn't want a treatment even though it has been proven to be effective. C, when the client is a minor or a child. Or D, both A and C. Anybody? Okay, good. So we got D, yeah. If someone can't make decisions for themselves, if they don't know who they are, where they are, that's basically not a competent person. And even though they may have not wanted something to be done in that particular state, you'd have to administer treatment. And children, very strict. I mean, you're legally obligated now to treat them, so that's very important. And that's basically it. Does anybody want to give any feedback based on what has gone on today? This is basically the closing. After this, I say farewell.
Extremely helpful. I think people really, really appreciate it. You raised so many important issues and many things people haven't thought of before quite this way. I was going to ask a question. What kinds of resources are being made available if it's a really obscure language? You know, you're going to be able to find someone who speaks Spanish or something, but what if someone presents and it's really an unusual language?
They have, it's actually a telephone service for any language that you need to, you know, get a translator for. So you would actually use that service. I believe AT&T has, they're one of the main providers of that. It could be costly, but you know, if the person didn't speak your language, you can basically use that service, and they would talk to the client, and then you would talk to them.
And I can add to that, every health facility is mandated to have language services.
Yeah.
It's part of the linguistic services.
And think of how many languages there are.
Yeah.
It's an amazing thing.
Yeah.
This young lady
Any other-
had a question.
I just wanted to comment that when I worked in Arizona on the phones, we used Monterey language facility in California.
Oh, yeah.
And they had, I think, close to 200 different language speakers, so it would take a little bit longer, but we had to provide that.
There's also a directory. Also, hospitals hold of health professionals that have different languages, that speak different languages if they need interpreter services face-to-face. So there is a directory in which they could.
Yeah,
So.
a lot of those times those interpreters are really not trained. They're not trained, and they don't keep confidentiality necessarily, things like that, which I think are key. Also, I worked with the deaf population a lot, and it's basically a big obstacle to getting healthcare services. But
Yeah.
there is a
That's an
Sorensen
excellent category to think
Yeah.
about, to consider. Yeah, the challenges.
Yeah. So the Sorensen is also a telephone kind of system. You might be able to use that system to access an interpreter online.
Yeah, I'm sure we'd have to go with whatever the policy of the hospital, because they'd have to approve of every interpreter, because it's so important. And often, unfortunately, I don't want to put my back to everyone, I've seen children as young as 6 years old as interpreting for the for patients, and that should be no job of a child, of certainly to discuss ambiguous information, and that may not be communicated clearly. Any other questions about anything else? I thank you for staying. I know it was long. Yeah.